Turning now to the pandemic, where President Biden ordered American flags to be flown at half staff yesterday to mark 1 million coronavirus deaths in this country. Members of Congress also held a moment of silence outside the U.S. Capitol as new COVID cases continue to rise all across the country. The latest daily average hit nearly 85,000. White House COVID response coordinator Dr. Ashish Jha joins us now to talk about all of it. Dr. Jha, good morning. Thank you for being here. Let's talk about COVID funding. We've got $10 billion in funding held up in the Senate right now. If the country doesn't get that money, how vulnerable would you say are we going to be?
Yeah, good morning, Tony. Thanks so much for having me here. We put in an emergency request for $22.5 billion, actually, to which we thought was sort of really the bare minimum we needed to get us through this fall and winter. Without that money, we're not going to have enough of a new generation of vaccines that Americans are going to need this fall for everybody. We're going to run out of treatments. We're going to run out of testing. So it's pretty urgent that Congress act, and Congress act now so we can be prepared for what's coming.
Looking ahead, you said recently that we could see 100 million new COVID cases in the fall and winter. That's an eye-popping number. A lot of people were raising their eyebrows. And some have said that maybe that's a politically motivated number in order to free up this funding. Where's your data on that? And what do you say to folks who say you may be playing with the numbers?
Well, first of all, what I would say is, we're looking at a range of scenarios for planning. What we're doing in the White House is we're planning both for the summer as well as for the fall and winter. And we're looking at a range of models, both internal as well as external. And some of them suggest that if we go into the fall and winter with no treatments, with no new generation of vaccines, no treatments, we could be looking at a pretty substantial wave of infections. We've had one each of the last 2 winters, and we obviously need to be planning for such scenarios. Obviously, we hope that doesn't happen. Obviously, we hope Congress steps up and does its job, but we've got to plan for those scenarios.
All right, let's talk vaccines. Kids under 5 could have a vaccine approved for them next month, but parents, according to polls, are still quite reluctant to vaccinate kids that young. What do you say to those parents? And how important is vaccinating the very young to getting us into the so-called endemic stage of this pandemic?
Yeah, so in terms of kids under 5, we're going to obviously have to see the data and what it shows before making a determination, and the FDA will make that. I will say so far the data on kids and vaccines has been very, very clear. I have 3 children, all of whom are vaccinated. Why? Because the benefits of vaccines clearly outweigh the risks. These are very, very safe vaccines, and they provide a very high degree of protection. I expect we'll see the same thing for kids under 5. We'll see where the data ends, but I really do think that they're very important for kids to get vaccinated.
All right, Dr. Ashish Jha, speaking as a doctor and as a parent, we appreciate it. Thank you.
Thank you, Tony.